Hello and welcome to another episode of the FemiNinja Project. And thank you so much for tuning in. I really appreciate it. And as always, I have a wonderful guest with me today. She has some incredibly important information to share with us, especially for those ladies out there who are listening, and even for the gentlemen who are listening. If you have a lady in your life who suffers with pain, chronic pain, this episode is for you. Her name is Amanda Laden. She is a women's health advocate who is dedicated to changing an outdated system. I want to highlight that, an outdated system. She is the founder and CEO of Period to Pause, a leading platform for elevating people's voices in their own health, healthcare system, and well-being. Her mission is to help women and other individuals change a system which wasn't set up by them or for them, and to leverage the power of story to see the humanity in all of us. Amanda, thank you so much for being here and welcome to the show.
Thank you for having me. I'm excited to have this conversation.
Oh, I've been looking forward to this for quite a long time. So I'm just going to turn it over to you and just let the audience know how you became an advocate for especially women's health and what you're trying to do to help change the system that is terribly, terribly outdated and doesn't always serve us well. Let's just put it to you that way.
Well, the system, I mean, there's so much we could get into with the system, but just know that the system wasn't set up by us or for us, and certainly does not serve us, the majority of us. And it doesn't serve the doctors either, right? It doesn't serve the health practitioners either. But my story was really, the reason why I came into this work and I started to leverage my voice is that this was born from my own story. So I was undiagnosed with a disease, which I would say probably for about 20 years. And anyone who has a uterus and has had their period knows that there are different ways in which your period presents itself. In my case, I had debilitating periods from the time I started having my period, which was around 16 years old. I would be bent over in pain. I would vomit. As I got older, symptoms got worse and worse and worse. I would bleed through my clothes, really embarrassing things. I was anemic at times because of the blood loss. And I would be going into my doctors. And it's not that I saw one doctor. I've lived in multiple cities around the world. And I would say to them, something's wrong. Like, are there any tests you can do? Is there anything that we can do here? Because I just can't manage this pain. It got to the point later when I was in kind of my late 30s where I would really have to manage my work schedule around my period. So 3 days out of every month, I would be in the fetal position. My pain, I couldn't manage my pain. They were giving me certain medications, one in particular, tramadol, which used to make me vomit. And so I wasn't able to get a handle on what this was. My ex-husband and I were trying to have children. I got pregnant a few times, each time miscarried.
Oh, I'm sorry.
Yeah. And which is terrible, for any woman hearing this and you've gone through that, it's just a horrible thing to have to experience, particularly if you haven't been diagnosed with something, you don't know what's wrong. And there's so much hope, right? There's so much hope to get there. We also had been going through IVF at the time. And so for those of you, when, I have a disease that finally got diagnosed, excuse me, called adenomyosis. And anybody listening who is familiar with adenomyosis, it's a cousin of endometriosis. When you are going through IVF, it makes your adenomyosis worse. So it's like if you have a garden and you're watering the garden, but there's weeds, the weeds are going to continue to grow. That's what IVF does for adenomyosis. So just imagine at this point, excuse me, when we're still going through IVF, trying to get pregnant, I have not been diagnosed. They keep putting me through rounds and rounds of IVF. Now my disease is getting worse and worse and worse. The thing with adeno too is that sometimes what it can present itself, because it's endometrium growing in the muscle lining the walls of your uterus, it is extremely painful. You sometimes look like you're 6 or 7 months pregnant because in my case, your stomach is so distended. But it took one IVF doctor finally to recognize that I had a disease. So the way in which that happened was that I had a miscarriage. I was further along. My uterus was further along, bigger in size than how far along I was with the baby. And so I miscarried, and she finally was like, wait a second, your uterus is presenting this way. You've been complaining about your periods forever. You are having these horrible symptoms. In my case too, after that miscarriage, I had to have a procedure, and then I developed a blood clot at the top of my uterus, and I had to have an emergency procedure as well. So finally putting these things together, she said, I think you have something called adenomyosis. Now, I don't know much about, now this is an IVF doctor. This is a doctor that looks at women all day, every day, and says, I don't know much about it. There's not many people who do. But and I was in Boston at the time, there happens to be a specialist in Boston, but first of all, I'm going to send you to go get, I think at that point, I was getting either an MRI or a CT scan of my uterus before I got sent to the specialist. And when I saw that doctor, he said, oh, he's like, honey, your adeno is everywhere. It is so diffused that there is nothing we can do for you except to remove your uterus. That's it. You'll never be able to carry a baby to full term.
Oh.
Yeah. So I was at that point, I then saw a specialist, but the infuriating thing was that there are things you can do now for adenomyosis and endometriosis. And had they actually listened, there could have been some things we could have done, not only, and, I'm at this stage where I'm at peace with not having children, and that wasn't my life path, but it's more about the quality of life and living a life where you're not in chronic pain, and also where you're not being dismissed all the time. So that's kind of where the story is. Fast forward to 2 years ago, and I ended up having to have a hysterectomy because I moved from Boston to San Diego. The specialist I saw in Boston had given me an IUD because that's a stopgap to stop the hormonally your adenomyosis and endometriosis from growing. It was the spring of, I guess 2 years ago, 2021, I was like, you know what? My symptoms are back. I'm starting to bleed again every day. I'm feeling pain. This shouldn't be happening. So I found a specialist here in San Diego. I finally got in to see her, and they did an ultrasound, and she said, oh, your adenomyosis is everywhere, and it started to grow over the IUD. It's taken it over. And she said, you're an emergent case. She said, we need to get your uterus out fast before it bursts. Like, we are concerned that something is going to happen, that you could die. Like, that's where we are. So I ended up having a hysterectomy. And it was in my 2-week post-op where my ex-husband asked the surgeon, he said, why didn't Amanda ever get diagnosed? If her adeno is so bad and it's one of the worst cases you've seen and it's everywhere, it had started to grow around other parts of my body too, outside of my uterus. So she laughed and she said, it was in the IVF doctor's best interest not to diagnose you because you were a money-making machine for them. There is no way they couldn't have seen her adeno. No way. So that's what angered me. And I was like, we need to change this system. Like, we are going to kill women, or we're dismissing them. We're not listening to them. And it's time to change. And it's time to use our voices to create the change.
Wow. What a story. Well, first of all, I just want to say, when you called that the adeno is like the cousin of endometriosis, I call it the evil cousin of endometriosis.
Oh, for sure.
Because it is just, it is unbelievable pain. And as you said, that, the endometrial lining lines the muscles of the uterus. My understanding is that the endometrial tissue actually grows through and into the wall of the uterus.
Yes.
And then when you bleed, you're actually bleeding into that area of the uterus and the muscle of the uterine wall.
Yeah. And, I'm not a doctor. I'll put that disclaimer out there. I just have the disease. And yes, that's correct. And so it's so, so, so painful. I mean, it is ridiculously painful and hard to deal with. And that's also, in our system, we just don't do enough research on certain diseases, adenomyosis being one of them, which is why sometimes if you still go to your OBGYN, they've never heard of it. And they don't know. They're like, what? That's not a thing. I still get that with certain doctors.
Wow.
Today. I mean, we're talking in 2023, and, doctors just aren't aware of it. They're more familiar with endometriosis, but the symptoms sometimes can present themselves the same or differently. And it is really important for anybody listening to this. If you have debilitating periods, if you're having cramping so bad that you can't move, like in my case, I couldn't, it got to the point for me where my pain management, I lived in Massachusetts at the time. I got my medical marijuana card. I was like, this is going to be the only thing that works for me. So, it'd be my period would come on and I'd say to my ex-husband, all right, just hand over the weed and give me my edibles and I'll see you in a couple of hours, because that was the only thing I could do to get through the day.
Help? Did the marijuana help? Okay.
Absolutely. It was the only thing that helped, because the over-the-counter meds, the ibuprofens, Advils, those don't touch it. As I mentioned, the tramadol they were giving me, which is a form of opioid, that would make me vomit. My body doesn't do well with opiates. And so, I'm just like, well, that's not helping either. And so, of course, now in Massachusetts, you can get marijuana anywhere, but at the time you needed a medical marijuana card to just go get it. And so, it was the only thing that I could do for my pain management. I had a tincture, I smoked it, and I had an edible. And those were the things that I would do for the first couple of days, because it was just so horrific and, embarrassing too. Luckily my ex was understanding. He understood I had this. And even at most of the time when I was going through that, I still wasn't diagnosed. So it wasn't until I got diagnosed, I was like, I told you, I knew something was wrong. And even my last OBGYN I saw before the diagnosis and before my IVF doctor figured it out, I was begging. I said, is there anything you can do to look at this? Like, what is going on? Anything you can give me? No, honey, you just have bad periods. And that was a female doctor. And so it doesn't matter, because they're just not getting the education about women's diseases that they need to have. And I urge people, if you're going through any of this, find a specialist near you. You can look on their websites. You can look in their credentials. Do they know anything about endometriosis or adenomyosis? It's probably going to be rarer that they'll know about adeno, but if they know something about endo, you're in with a good chance for them to listen to you and to understand and to at least get some form of diagnosis. I'll also say that when we talk about it being, the ugly cousin of endo, they often travel together. So you might have one, or they can see some endometriosis maybe on, one of your ultrasounds or MRIs or whatever you're getting at your doctor's office. And sometimes they can't see the adeno because it could be so weaved into your uterus and into the muscle that they can't see it. But in my case, it was diffused and it was everywhere, that, there's no option for them not to see it.
And as I told you before we started recording, I have adenomyosis and suffered for years and years, over 25 years with it, not knowing what it was. Of course, had gone to multiple doctors and stuff. And I was the pain of the adeno, as bad as it is and was, the pain of being dismissed, denigrated, humiliated, insulted. And I'm a medical person. And the way that they were treating me was absolutely devastating, that finally it was like, I'll just deal with the pain. As long as I don't have cancer, I'll just deal with the pain, because who knew what it was?
Yeah.
And it was just such a nightmare. And when they finally diagnosed it, I was 47 at the time, and they saw it on an ultrasound. It was a doctor I hadn't been to before. And she says, we never see this on an ultrasound. She says, your case is so advanced. You can see varicosities on the outside of the uterine wall. And it was like, oh, yay. So at least I'm validated. And she says, typically what happens, because you're right, you can't typically see it on an ultrasound. And she says, typically what happens is we have somebody who complains about pain or whatever, and they see the adenomyosis in the pathology report after they do a hysterectomy.
Well, and that's interesting you say that, because that is perpetuated that, oh, we can't see it. My doctor here in San Diego will say that's BS, because now technology has gotten so good that it's almost impossible not to see it if you have a good tech in your office. So if you're going through IVF, if you're a female that's, getting your annual, and you're getting, they're looking at your ovaries, they're looking at your cervix, they're looking at your uterus, they can see it. It's just maybe the training isn't there for them to understand what it is. But now with technology, my surgeon here says there's no excuse for them anywhere not to be able to diagnose a woman anymore, because the technology and the imaging has gotten so advanced that now they can see it.
However, that was when they finally found it on me when I was 47. That was 20 years ago.
Right.
So the technology wasn't nearly as advanced as it is now. And I had another ultrasound recently, it was about 2 years ago, I think. And you could still see the adenomyosis, because I
Mm.
was lying on the table and I was looking at the screen, and it was, pointing out the adenomyosis and the I can't remember how they called it, the adenoma tissue or
Hmm.
whatever. And it's like, oh, it's still with me. I still have that evil cousin, but
Yeah.
it's not doing anything. Thank you, menopause.
Well, yeah, and obviously with hormones and things, those things shift. But these are the things that I think sometimes what you were saying of like they can't see it, or oftentimes they can't see it. These are the things that get perpetuated in
Hmm.
this system, and so then women feel like, well, they're not going to be able to diagnose me, and they don't know, they can't see it. That's not true anymore.
Hmm.
Now it's like now there's, like I said, there's no excuse for them not to
Hmm.
see it, and
Hmm.
if you are with a medical practitioner who is like, no, that our technology doesn't allow us to see that, or we're not trained to do that, go to the next person.
Yeah.
Because anymore, that's just lazy. It's just like,
Mhm.
oh, we're not going to treat our patients in a way that actually gives them the medical care that they need. And, because this is a women's disease,
Mhm.
and we don't care enough about women, we don't put enough research into
Mhm.
women's diseases. Um, there aren't a ton of experts out there, but with social media today, with technology, with everything
Mhm.
else, there are plenty of experts out there that you can listen to. There's a few famous doctors. Mine is actually one of them. Mine out of Boston was one of them, one of the leading adenomyosis specialists in the world. It just so happens that two of the leading adenomyosis specialists in the world are Italian, but they're based in America.
Mhm.
And one is Dr. Vitale out of New York City. And he has a social media platform that he has blown up over the past couple of years. He
Mhm.
talks about all things endo, all things adeno. You can DM him, you can ask him questions. He goes live sometimes.
Wow.
He'll point out what it looks like. So now with all of these things in the public domain that we have access to, and like Dr. Vitale out of New York, you can be like, oh, is that my symptom? And you can
Mhm.
bring that to your doctors now. You can say, I've been watching this doctor, and I'm not trying to be, Google diagnosis here, but
Mhm.
I'm watching
Mhm.
this doctor and these are my symptoms. And it feels like now you can actually be seen in a certain way. And what you were saying before about this dismissal, I mean, one of the things that infuriated me when my doctor said, well, there's no way they couldn't have seen her adeno, is
Oh.
that is I was like, I'm an educated white woman. Like, what is everybody else experiencing?
Mhm.
I'm being dismissed in the system for 20 plus years. Oh, honey,
Mhm.
you don't know your body. And, back to just for that, I'm going to pause on that for a second. We know our bodies, we live in them. We're
Mhm.
pretty attuned, most of us, to our monthly cycles. We
Mhm.
know, I mean, we're all different too, right? Your cycle might be 3 days, somebody else's cycle might be 7, or period, sorry, might be 7. Me, I was 28-day cycle every single month on
Mhm.
time, 28, 28, 28, regardless of my adeno. I just knew, and I knew something was wrong. I could feel it. It was presenting symptoms elsewhere. And anybody who's listening that has had something where they have chronic pain, you
Mhm.
don't even know what you're like without it.
Mhm.
The second my uterus my surgeon was like, trust me, when your uterus comes out, yes, it's going to be, there's a few things that go on there in terms of, and I don't think we talk about enough in terms of grief of like, you're
Mhm.
removing a major body part.
Mhm.
You are removing something that society deems that you to have worth and value on, because
Mhm.
that's what provides life, right?
Mhm.
um and there's that whole thing that I went through from a grieving standpoint of not being able to be a mother, and then, oh, now this major body part is coming out. But
Mhm.
the dismissal goes in a lot of different ways, even of my doctor saying, oh, you're going to feel terrible for 2 weeks and then you're going to feel like a new woman. Yes, and what about all the other things,
Right.
right?
Mhm. And the fact that you're going to be just, you know, surgically transported, boom, into menopause. There's not this, gradual change that typically happens. It's like, boom. I don't know what
Mm,
it's like. I didn't have a hysterectomy, so I went through menopause the natural way. But I've talked to so many women who said it was just like a nightmare, because all of a sudden it's not the gradual onset of symptoms of menopause. It's just like boom.
well, and that's interesting you bring that up, because even at my doctor's office, it's like, okay, you're up for, in my case, I still have my ovaries. So technically in perimenopause, but
Mm.
overnight.
Mhm.
And nobody's talking about that. So it's just like, okay, we'll see you back in 2 weeks for your 2-week post-op. Anything else? Like, should I be, should my hormones be tested? Should I be on anything?
Mhm.
Should my diet change? Should I be, anything? So I had to ask my surgeon, I had to say, could you test my hormones, please? Where
Mhm.
am I in terms of, because I said, am I automatically in perimenopause? And she said, well, not necessarily. I was like, but I don't have a uterus and I don't have my cervix. So there's clearly something going on hormonally. And you can tell, again, we're living in our bodies. I can tell there's shifts. So in
Mhm.
my case, I don't need estrogen and progesterone. I don't need hormone replacement therapy at the moment. But what I need is actually testosterone, which is
Mhm.
also interesting. Now, I'm in this place and I'm very infuriated right now because I ran out of my testosterone 3 weeks ago.
Mhm.
I've been calling my doctor's office for 3 weeks. All you have to do is tick a box to get the prescription to my Walgreens, and still don't have it. And I called them yesterday again. I've emailed the doctor because she knows, because I am vocal with her about her front desk staff and the
Uh-huh.
treatment I get and everything else. And I finally emailed her saying, could somebody please approve this? My body doesn't feel right now. Now, I want to put this in context too. Every time I have to get this, I have to get approval from the insurance company because this isn't a female drug. This is a drug that men need, right? And so men do not need approval for it, and it does not cost as much. So, yeah. So my testosterone gel, if we can't finagle some type of discount, is $380 every time I get it. Ridiculous. But if a man needs it, it's free. If you have
Oh.
if you have low testosterone count. So here we are again, and it's like my body needs this because it's not producing this in a way that's sustainable for, I can tell. I even like, because I've been off it a couple weeks, I can tell I'm like more irritable. I have some weight gain, like, things that are happening that shouldn't be happening. And it's like, what is going on? All you have to do is tick a box and get this over to the doctor's office. This is so unacceptable.
Mhm.
So if it was, again, I think this goes back to, we just don't care enough and we don't do enough research on women's diseases. We continue to also dismiss us, dismiss our pain, dismiss the fact that like this does affect, like when you're on a hormone for however long you're on a hormone, when you come off it, it's a form of withdrawal for your body.
Right.
And so it's just, all of these things where the system has to be changed and we have to shout louder and care more about
Mhm.
what we're going through. And it's very interesting with menopause because I feel like it hasn't really been talked about publicly, so to speak,
Mhm.
until very recently.
Mhm.
Maybe the past, call it 5 years, maybe it's been a little bit longer than that because it
Mhm.
wasn't necessarily on my radar, but I'm
Mhm.
very heartened by all of the experts that are out there
Mhm.
that are talking about the varying stages of perimenopause and menopause and how we're not a monolith. Like
Mhm.
your symptoms are going to be very different from my symptoms. And we shouldn't be treated as, oh, let's just throw this solution at all of the women, because we have very different physiologies.
Mhm.
And we're just not being treated like that. I'm very heartened though by all the experts out there that are coming out there and all the possibilities, bioidentical hormones that you can have access to. You can get,
Mhm.
now there's telehealth and telemedicine where you can send in your blood panel and you can talk to an expert on the phone. What
Mhm.
is disheartening about that is the access to it and the price. So, we're not, all of these menopausal treatments are not being covered by insurance. And
Mhm.
sometimes people don't have insurance, right?
Mhm.
And so now we're having to go out of the system to pay for things that we actually
Mhm.
need in order to have a quality of life.
Mhm. That was another question I was going to ask you, but I think you've already kind of answered it. Was, if have you ever seen a naturopath? Because I've worked with a naturopath, two different naturopaths over the years, who have helped me tremendously in a lot of ways. And the one that I'm seeing now, actually, I'm really due to check back in. You know, she's constantly, she's checking the blood work. She's looking at the hormones. You know, she's doing everything through supplementation. And it was so much more affordable than I had expected.
You know, that you bring up a great point, and it is probably something that I need to find one here that I like. I have on my podcast interviewed a few experts in the menopausal space that have varying programs or supplements or things that where they can help women. But yeah, I think it's time. I mean, just what I've been saying, that I've been 3 weeks without a very simple fix.
That is incredible. And that is just so non-acceptable. I mean,
It's unacceptable. Yeah. And
it's almost cruel.
right. It's like, how hard can it be? I know what you have to do. You have to tick a box and send it over to over to the pharmacy. That's it.
Yeah.
That's
Yeah,
all you
let
have
me
to
work
do.
your front desk for one day and I'll do it for you, or I'll
Yeah.
coach you through the process.
It's
That
just
is unacceptable.
but I think it is probably time for me to find a new doctor. I mean, I love my surgeon. Every time I'm in there, I can say whatever I want. She listens. She's young. And so she also has a different perspective than her older male counterpart. They have a very good practice here in La Jolla, in San Diego. But stuff like this, it's just like, it's just, yeah, it's unacceptable. But the other thing you mentioned, your naturopath, the other thing that I firmly believe in marrying our Western science, our Western medical practices with Eastern medicine. And one of the things that did help me with pain management and also did help me to ask the right questions of my doctors was finding a specialist acupuncturist in Boston who focused on female, whether it was female diseases or people trying to get pregnant, they would go to see them too. They were a godsend. They knew what adenomyosis was. They knew how it presented itself. They knew before the doctors. They knew more information than the doctors, except for the specialist that's there in Boston. But they were like, okay, so now you're going to go see your surgeon or your doctor. Here are the things that I want you to ask him. Here's the 5 questions. And then we're going to make sure. And every time before I would have a cycle, I would go in to see them. They would put needles somewhere. I would keep some of the needles in my ankles that stick and some in my ear to stop, to help the pain. They also had points they could use to stop some of the blood flow. So, they were really extremely helpful in managing the disease and pain management. And so for anybody who has the means to find somebody like that, I highly, highly recommend it. I feel for women in America that are in rural areas that may not have access to some of these practitioners. But, again, what does give me some hope for whether it's adeno management or menopausal management is that there are resources online now that people can get access to. I'm not saying it's cheap and I'm not saying it's easy. But at least there's some information out there for people that you may not have had access to before. Even, 2 years ago, or I got diagnosed with my adeno 4 years ago. So even 4 years ago, when I would go online, there was nothing online about adenomyosis. And so now, again, like I said, with Dr. Vitale and some other doctors, there's also an endo doctor out of Arizona. I can't remember his name right now, that also has a public platform. At least providing the information for women and getting information from specialists and doctors, not like going down the Google rabbit hole where every layperson is sharing their diagnosis, but really getting true information from specialists, I think is very helpful. I can't stress enough, though, if you're going through any of these things, whether it's debilitating periods or you're just sensing, oh, I might be stepping into perimenopause, to really find some resources to help. The other thing, and we've talked about now my miscarriages, my disease, my perimenopause, hysterectomy. I wished at the time of my miscarriages that I would have had somewhere to go. I didn't feel I had anybody to talk to. There were a lot of people in my life that didn't even know I was pregnant because we weren't sharing it. And so having somewhere to go, I feel for people that go through anything like that, any type of loss. It is extremely hard, especially if you've been wanting to start a family and you're at that point. For us, we were in the clear. So we had been transferred from our IVF doctor to our midwife. And, just finding a community. I was fortunate in that where the hospital where I miscarried in Cambridge, Massachusetts, offers women a counselor if you've gone through any type of trauma related to childbirth or pregnancy. So they offer you a counselor for 6 months, whether you miscarried like myself and had to go through a procedure, whether you had a stillbirth, whether you just had some trauma in the labor and delivery room. And so I took them up on it because they were specialists. Those therapists, those counselors are specialists in any type of childbirthing trauma and pregnancy trauma. The caveat to them was that sometimes if there was something going on in the labor and delivery room, they would get pulled. So they would get pulled into the delivery room. Having said that, they gave me some tools to be able to navigate what people don't talk about enough, or what I think, and I'm going down I'm digressing a little bit from my adenoma disease, but I think what we don't talk enough about with women and in general is miscarriages. We don't talk enough about it. And we don't talk about the grief that happens. In my case, it was like a triple whammy almost. It was like, okay, so we finally got pregnant. Then we lose the baby. And then I'm on all these hormones because we had gone through IVF, all these hormones that really mess with your body. And in my case, a lot. And I went through a deep state of depression. And we don't talk about that enough either. I also had people around me who were like, well, you were only X number of weeks along, you should be fine. Or, well, at least you didn't have a stillbirth. That's like comparing grief and trauma. And it's like, we need to stop doing that.
Again, that's just belittling and diminishing and marginalizing your experience. And it's just salt in the wound.
Oh, it's terrible. And we need to stop asking women how far along they were when they miscarried. Why does it matter? Why does it matter? They have experienced, it doesn't matter if you were 2 weeks along and knew you were pregnant, you were 6 weeks, you were 12. I mean, it's still a loss. It's still something you felt in your body. Stop asking that question. And also stop comparing grief. Still to this day, I know the date I miscarried. And every day on that year, and I had other miscarriages too, but this was the one where we were in the clear, right? And so that's the one that was like, we were hopeful, I actually was pregnant with twins. And then early on, I had lost one already. So early on, one wasn't viable. And then later on, when we were cleared, the second one was viable. So, it's like, you're going through all of that hope and all of those things. And so we need to start to create spaces and communities where we can just listen to women and honor their lived experiences. And as you said, like, not dismiss. It's so painful to go through that. And, as I was saying, every year I know the date and it's a hard day for me. The other days that are hard for me, and, if you have women in your life who are trying to get pregnant or have had losses or whatever the case, or maybe don't have a mom in their life, whatever the cases may be, certain days of the year can be very painful, like Mother's Day. I mean, check in on your friends because it's hard. And I have another girlfriend who also miscarried through IVF and is not able to become a mother. And I check in on her on Mother's Day. Now, for me, Mother's Day is a little bit of a weird one. And it's not lost on me that my disease was in my uterus, but I was born on Mother's Day. So I was the first baby born on Mother's Day in my hometown. My mom left when I was 2, and I wasn't able to be a mom. And so to me, it's not lost that, like, my disease manifested itself in my uterus. And also, I'll sidetrack for a minute. I think there's something around intergenerational trauma and breaking a cycle. And I was the person in my family to break the cycle for the female lineage. But, so I digress there for a minute, but I just think we need to have more spaces and places of community. And part of where I was going with that was like, I wanted a community to I wanted, not that somebody's miscarriage is the same lived experience as mine, right? But I wanted somewhere to be able to go. And I didn't see where that was. Same with going through a hysterectomy. People are like, oh, your quality of life is going to be so much better. In my case, yes, it absolutely is. However, it's
But
still a loss.
mhm,
You're taking out a major body part. Like, you know, it is a loss. It is a grieving period. They also, luckily my surgeon here had warned me and I had said, you know, a lot of women when they get a hysterectomy go through a form of depression. If you
mhm,
get to that point, at any point after this, you need to come and talk to me. So
mhm,
that was like great that she actually was like, just fair warning, it's not
mhm,
abnormal. We're going to put this out there that this is normal.
mhm,
And your grief, your depression, your process of healing might look different from somebody else's.
mhm,
The other thing I'll say about this is, you know, with all of this, we're talking about our bodies, right? We're talking about the trauma that lives in our bodies.
mhm,
And one of the things that I sought out, I'm lucky enough to have in my circles, you know, I'm an entrepreneur, I own my own business, and I have a lot of entrepreneurs in my sphere and
mhm,
entrepreneurs who are healers as well.
mhm,
And I have a good friend of mine. She's a somatic therapist. Her name's Ani Anderson.
mhm,
She and her husband run a company called New Way of Health, and they do a lot of online work too. They also train up and trauma-informed somatic coaches and therapists. But
mhm,
I went to see her after my hysterectomy. And I say see her, it was online because she lives in upstate New York and I live in San Diego. And so she helped me to give me some practices of getting back into my body because
mhm,
I lived outside of my body for so long. When you're in chronic pain, you're not
mhm,
fully living in your body.
mhm,
And I had to learn to, number one, get to know my body again.
mhm,
Number two, to love my body. You know, I hated my body for a while, right? I
mhm,
was so pissed off at it. You know, it
mhm,
didn't do the thing that it's supposed to do on this planet, which is to procreate,
mhm,
and which is to be able to have a child. And I was pissed off at it, right?
mhm,
And I needed to get back into a place of loving. I needed to feel again. I needed to feel it.
mhm,
And so, anybody who's listening that might be going through some type of chronic disease, or maybe you have to have a hysterectomy or
mhm,
whatever that might be, I would highly suggest finding some practitioners that can help support you in these transitions, so to speak, but
mhm,
also perhaps a somatic therapist to help you get back
mhm.
into your body.
Mhm. And if I can toss out a few more yeah, out there, even something like Reiki, cranial sacral
Yes.
therapy, Feldenkrais is absolutely
Mm.
incredibly powerful. I'm a practitioner, a Feldenkrais practitioner, and it's amazing stuff. Just really the somatic connection is
Mm.
just so important because you do disconnect from your body,
Oh, yeah.
and that's part of the recovery is reclaiming yourself and reclaiming that
Yes.
not only your physical body, but your spiritual body and that inner strength and power that's in each and every one of us. I, of course, always call it the warrior spirit because
Yeah.
that's kind of says it all.
Well, I mean, think about that, you know, especially if you've been dismissed by a system for
Mhm,
20 plus years, you're basically being told you're lesser than. You're not
mhm,
important. And you are giving away some of your power. Your power is being taken away from you to a certain extent.
mhm,
And you know, you start to believe like, oh, I don't have this spirit. I don't have this inner
mhm,
warrior. And I'm glad you bring up these other practices because whatever you can do to get embodied and also to integrate again mind body
mhm,
spirit whatever you believe, and to take back the ownership of your body, to take back your voice,
mhm,
to start using your voice in these systems to create the change,
mhm,
to stand up to your doctors. Like, you know, when we get off this, I have another call when we're done here, but after that I'm going to call my doctor's office again and be like, what the heck is happening? This is not okay. Like, you know, just and I even when I had a conversation, there's another story that goes with this, but my surgery, my hysterectomy got canceled the first time around,
oh,
um, morning of,
oh
um,
my God.
because they didn't read my charts properly. And so I'll just give you the shortened version. I have two small aneurysms at the base of my brain. And
Mhm,
so when you're having a hysterectomy, your head is below your heart. And
mhm,
it can, if you have any presenting symptom or any presenting anything else like that, you know that that raises your chance of stroking out or bleeding out on the
mhm,
table. They didn't read my charts properly and see this, and they didn't tell me I needed neuro clearance. So my hysterectomy got canceled morning of, and I had to get rescheduled. Now, that presented a few problems. One, because this is during time of COVID, my surgeon had gone to the board of the hospital to get me in because I was an emergent case, but they tried to blame me. And I said, I was like, her nurse called me, the one that I'm about to call, and said, well, we're going to have to cancel. You didn't. I go, here's what you're going to do. You're going to hang up this phone. You're going to get I won't say her name, but you're going to get her on the phone immediately with me. Well, I said, when she comes out of surgery, the first thing she's going to do is call me. And I kind of gave her what for. And I said, you are not going to put this on the patient. You are not going to tell me this is my fault. Your team has looked at my chart every single day for the past several months, because I would call her office 3 times a day because the surgery was getting moved. And, she was concerned my uterus is going to burst. And she goes, wait, you call my office? I said 3 times a day, every single day. And she was like, and I said, and your team is so rude to me. And I said, it's unacceptable what your team is doing. And, she goes, well, they need to fight for you. We have to be. I go, no. I said, they also need empathy. And anyway, I kind of gave her what for. And I said, I do this in organizations all the time. And, my day job, I'm a consultant. So I work in organizations to help leaders have empathy and compassion, but also, just to align people in growth. And I said, it's unacceptable. So once she got off the call, she called a team meeting, and had a conversation with her team about patient care. But it's just like, when we talk about how to change the system, I think we have to come at it from both sides. We have to be louder. We have to say what we need. We as women, as a collective, have to start speaking up more, have to share resources with one another, have to share doctors, practitioners, these practices, like you just said, that maybe women don't know about. And on the other side, we have to also equip the people that are working in the system to also have a voice and to create some change and to lead with empathy. I do feel for doctors and people within the system right now, because they didn't sign up for that either. They didn't sign up to see patients for 7 minutes and not be able to give them the care they need. That's not what they signed up for. So all around, as I think we started out this conversation, the system isn't working for anyone. And so it's time, I think we're going to see a lot of shifts in the medical system in the next several years. I think with burnout at epidemic proportions, we're going to see a lot of doctors and practitioners leave too. And
we already have.
We are.
I interviewed a woman several months ago. She's actually in the process of retiring. I'm sure she has by now. She's a physician, a family physician, who actually went from being a physician. Now she's an author, has written several novels. And a lot of the novels are regarding, like the society today, medical practice, and, they're fictional, but of course she has true stories that are interwoven into a lot of them. But she said that, it is so incredibly difficult to function as a physician in this current medical model, or whatever the heck it is, that she says, not only are doctors walking away, she says the suicide rate for physicians is astronomical.
It's awful. I mean, they can't win either. I'll just share one other quick anecdote. When I got my bill for my hysterectomy, so that would have been January 2022, I got the bill. My surgery was the day before Thanksgiving in 2021. And then I got the bill in 2022, $196,000. That's how much my surgery cost. That wasn't including the anesthesiologist. No. And I was like, okay, my surgery was done by a robot. I mean, it was. I'm not dismissing that, because thankfully we have modern technology, and the Da Vinci robot is amazing. And my surgery went off without a hitch, and they were able to clean up. I had stage 4 endoscarring in there, and my adeno was wrapped around my ureter and starting to move around other organs. They were able to clean all that up. I'm very grateful. But $196,000, no wonder why people aren't going to get the life-saving surgery they need, because of course it's going to bring anyone to their knees, right? I mean, I'm lucky that I had insurance at the time, and it covered most of it, but still, who is getting paid? Like, I mean, again, we look at the system and the way it's set up, and if you follow the money, who's getting paid, and who's winning here, because it's certainly not the doctors and it's certainly not the patients.
This is one funny story. It just triggered in my brain when you were talking about that. The last time I did have surgery, I had a DNC back in, I think it was 2019, no, 2017. And, my husband's bringing me home from the hospital, of course, his day surgery, blah, blah, blah. And, he brings me into the house. He goes out to get the mail and he comes in and he says, "You have something from the anesthesiologists." And I'm like, "Really?" The
Ah,
bill made it to my house
before
before
you
I
did.
did.
Of course it did.
Is
Of
that
course it did.
unbelievable? And I'm like, how did they know? Maybe, I didn't show up. Maybe the
Right.
surgery was canceled. But no, that thing was in the mail and it made it to my house before I did.
I mean, or maybe you needed extra anesthetics. Who knows? Or less. I don't know.
Right.
Oh,
That was
wild.
unbelievable. I
Wild.
couldn't believe it. And like I said, I'm a medical person. I spent 40 years in medicine, first as a respiratory therapist, then as a physical therapist. And it's just so discouraging and disheartening to see where we're at right now. But,
It is.
thanks to people like you, I think the tide is changing. People are finding their voice. Even as recently as 20, 30 years ago, people were not speaking up for themselves because the doctor
Yeah.
was the ultimate authority. Well, that doesn't work anymore.
With the God complex. Yeah.
Yeah. Yeah.
And now it's like, oh no. I mean, I just want women to hear this over and over again. You know your body better than they do. I'm not dismissing their multiple years of experience and training, but
Mm-hmm. But
even to this day, they get at maximum, or on average, I should say, 2 hours of training or less of training around menopause. To this day, it's 2023. So again, when I say find a specialist, whatever you're going through, make sure that if you're going to see an OBGYN and you think you're going through perimenopause or menopause, that they actually have had some education on menopause, because
mm-hmm.
most of them haven't.
Mm-hmm.
And so just the little things like that, where it's like that whole system. I mean, that's another thing we could talk about, but that whole system of education and how they're being educated from
Mm-hmm.
also a lens of intersectionality. Most of them aren't getting any type of training around diversity and intersectionality, let alone,
Mm-hmm.
oh, now I'm going to have to understand all these diseases and why cultures present differently. I mean, there's a whole thing we could go down there, but I just believe, until we start talking about these things more, and until women have the same opportunity to have health equity that everybody else has,
Mm-hmm.
because our disease, we are taxed more, our drugs cost
Mm-hmm.
more, our surgeons cost more, all of that. Until we start to look at this with a different lens and have some parity, nothing's going to shift. And so it's incumbent on all of us to
Mm-hmm.
use our voices, to
Mm-hmm.
share our resources with our friends, to shout louder, and to start to change the system one voice at a time, really.
Absolutely. One thing I really want to emphasize right now before we close, because I know we're getting to the end and you have another call, but one thing I really want to emphasize that is so important, and I've said it before on this show for the listeners, to really pay attention to your body,
Yes.
really go through that process of self-awareness, self-discovery, because the more you know and the more you can feel in your body, the more you can educate yourself, the more you empower yourself. So when you do go to the doctor, you can say, this is what's happening. This is what I'm feeling. This is the research I've done. You have some of the tools. So you're not just walking in blind saying, somebody fix me, because then
Yes.
you are handing your power over to another
Yes.
individual who might not have your best interests in mind. And even if they do, they don't have the time to really do the deep digging. If you educate yourself, you empower yourself. Knowledge
Yes.
is power.
Said like a true warrior.
I get very passionate about that. I just heated myself up a little bit. So anyway, Amanda, it is so wonderful to talk to you. And I
You
am sorry
too.
about all your losses and what you've gone through. I just can't imagine how difficult it has been. But again, you have the true spirit of a warrior. And I'm going to be thinking about that phone call you're going to be making in a few minutes.
Stay tuned.
But until then, go ahead and give us some of the links where people can find you, where they can contact you, get in touch with you. If they have
Yeah.
any questions, of course, all of this is in the show notes forever and ever, but I really like for the guests to be able to give that information out themselves.
My website and all of our social handles are period to pause spelled out. So, from period to menopause, everything in between, period to pause. I'm also Amanda at periodtopause.com. So that's where you can find us. So yeah, and check us out on, we also have a podcast, Period to Pause. We're going to be taking a little bit of a sabbatical here.
Mhm.
We've come up to about 80 episodes and I need a break. So, but
I
yeah, you can,
understand.
there's information there. But yeah, we're wherever you get your podcasts, it's Period to Pause.
Okay, and I will have the podcast listed then too on your show notes. Um, Amanda, thank you so much again
Thank
for being
you.
here. You really are a true warrior and a voice for empowerment.
Oh, I appreciate you. Thank you.
Yeah. Everybody, thank you so much for listening. Wow, you certainly got a lot of information from this or this show today. So just remember to empower yourself. I cannot say it enough. Knowledge is power. Understand your body. Get help from alternative practitioners if you need it. There are so many wonderful different modalities out there. If one does not work for you, just keep on looking, because that puts you in the driver's seat and you're the one calling the shots. You are in control of your body and your health, not the other way around. And that is the way of the FemiNinja.